The meeting's being live streamed. Okay, that's fine. Hi everyone, this is Women Empowerment and Healthcare Organization, and we are here today hosting a shadowing session for internal medicine. As we go through the session, if you have any questions, please drop them in the chat box. There will also be a small quiz at the end to record your attendance and obtain your hour. We have here with us Dr. Wall, so may we please ask her to introduce herself and begin the session whenever you're ready.
Okay, hi everyone. Sorry for my tardiness. I am coming straight from the hospital and had to deal with some critical patients. And unfortunately, on the way there, I lost some of my PowerPoint slides. So we're going to freestyle this today. Sorry for that. So let me tell you a little bit about myself. So my name is Sheri Walls. I am a PGY2 internal medicine resident in Georgia. And I am what they call a US IMG. So I am a US citizen. I was born and raised in the US. And I went to international medical school, which is international medical school graduate. That's what US IMG means. So I went to a Caribbean medical school by the name of Ross University School of Medicine, which is now located in Barbados. And I subsequently matched into my number one choice at Piedmont in Georgia for internal medicine program. So a little bit of backstory. I'm the oldest of three, and I'm the only girl. I have played basically almost every sport you can think of, but like my go-to during my childhood was like basketball and track. And I didn't play in college, but basically from high school all the way down, I played sports year round. And then I went to college in Houston, Texas. I majored in biology and minored in chemistry. I was a pre-med major. I did a lot of extracurricular activities during college. I was a part of like undergraduate medical academy, minorities of medicine, and I was also a tutor for biology classes. So I tutored basically general biology, microbiology, and I think was it molecular biology. Sorry, it's been like 5, 6 years since I graduated from college. And then I took a gap year, and a gap year is basically the time that you have in between college to medical school. So I took a gap year, and during that year, I did research, and I was an ER scribe at night. And what I did in research was I was basically growing neurons from teeth, and I would do that during the day, and at night I was a scribe. And then I got into medical school, and then I graduated medical school in May of 2021. And now I'm a practicing physician, a resident in Georgia. So how can I help you guys today? Any questions?
I think the participants would like to know a few of your day-to-day cases maybe you look at, and just your regular day routine maybe.
Okay. So let's see. So basically, sorry, the hospital keeps sending me messages. So basically, what I see is basically heart failure, COPD, which is like chronic obstructive pulmonary disease, pneumonia, encephalopathy, which is like confusion, but can be caused by roulette stroke, or if that's a pulmonary embolism, or if the patient is infectious for whatever reason. I also have seen lung masses, lung abscesses, necrotizing pancreatitis. I mean, that's the best thing about internal medicine is because it's so broad and I get to see a multitude of cases. For example, I think within like the last 2 weeks, I've seen like severe cervical stenosis requiring emergent surgery, neurological surgical intervention. I've seen strokes with conversions. I've seen, I mean, not just within these 2 weeks, but just overall throughout my first year I've seen a lot of different cases. And with internal medicine it's basically adult medicine, and that whether that is cardiology, pulmonology, gastroenterology, etc. So you see a broad range of basically adult medicine. So what I do is internal medicine. I don't know if you guys ever been admitted to the hospital, but when you go to the hospital in the emergency department, you see the emergency room physician. And after they decide, hey, you're stable enough to be discharged, um, or hey, you need to stay in the hospital for further management. So when you move up from the when you go up from the emergency department to the other room upstairs, that's me. So I'm the one that's basically putting all the pieces together in order for you to be treated properly. I have to figure out your underlying diagnosis and treat that properly. And if there's something else going on and I need a little extra help, I then consult the specialists, whether that's the lung doctors, that's pulmonology, or if it's the heart doctors, that's cardiology, or the kidney doctors, that's nephrology. But the best thing about my program is that they really try to teach you how to manage all of the problems by yourself until you actually need to consult a specialist. So they really provide us with the tools in order to be successful outside of residency and teach us how to be good clinicians. So that's what internal medicine is. And basically the reason why I liked it is because it was broad, and I really liked inpatient medicine, and internal medicine is mainly inpatient medicine. You can still do outpatient clinic work, but a good majority of it is inpatient medicine. So my day-to-day, so it depends on, since I'm in residency is the part where you go from medical school and then you pick where you want to specialize in for the rest of your career. So with internal medicine, that is 3 years. So I'm currently in my second year. And from my second year, sorry, the hospital. From my second year, I have a year and a half left. So residency is really hard, but it's a lot of fun. And it's very challenging, and depending on where you are and what block you're in is dependent on how your schedule is going to be. So on, like right now, I'm in inpatient medicine. I'm on what they call floor or wards. And basically that's depending on what day it is. Like today I was pre-call. So that means you come in at like 5 in the morning and you get off at 5 p.m. Or if you're long call, then it's like 5 a.m. to 7 to 8 p.m. at night. And that's on like inpatient, and that's like 6 out of 7 days you're working. And then on clinic, you work Monday through Friday, like 8 to 5, except for on Thursdays, Thursday and Fridays is like 8 to 2 or 8 to 1. And you have basically your weekends. So that's what, it just depends on where you are, what you're doing, and what are your responsibilities. So that's what basically internal medicine is and what my day-to-day is. So if you have specific questions for like inpatient versus outpatient, I can go into delve into that. Just let me know which portions you want to know, because it's going to be dependent on where I am in the hospital.
If you wish, you can talk about both of them separately, or we also have some questions in the chat box if you would like to answer those first.
Okay, so I'll start with the inpatient. So inpatient, that's what I'm currently on. That's a 6 out of 7 days. And because it's 6 out of 7 days, you're going to be working a little bit longer, but I honestly prefer inpatient. I like the acuity of the patients, meaning that there's something that's going on that needs to be addressed right now, whether that is pancreatitis, whether that is heart failure, where that is a pulmonary embolism, where you have a clot, versus just managing chronic conditions or preventative medicine, which is more outpatient. So right now, this week, I worked Monday through Saturday, and I worked from about 5 a.m. to about 5 p.m. or 5 a.m. to 7 p.m., depending on if I'm on call or not. But today I wasn't on call. I just had a little bit more to do as far as severity of patients. So usually I get there at like 5:30. And then when I get to the hospital, I go see my sickest patients. If those sickest patients are in the ICU, that's where I start first. And sometimes I can carry up to like 13. The cap in our residency program is 18, meaning that you can have 18 patients that you're managing at one time. So you see the patients, I see my patients based off severity. So I usually start in ICU and PCU, and then I work my way down from there. And then around like 7 o'clock, I will get signed out from the 19 about what happened with patients and if I have any new admissions, if I'm not already capped. Because the cap is 18 patients. That's the amount, the most you can have is 18. So I do that, and then I go see any patients that I wasn't able to see before 7 o'clock. Then I go to morning conference, which is basically you're sitting in a room full of all other residents and you're going over cases and basically how to be the best clinician that you can be. And then you round. So rounding meaning that you go along the hospital. I don't know if you ever seen like Grey's Anatomy or House, when there's like 4 or 5 doctors outside a room and they're talking about the patient. Is like that. That's probably like the closest thing that you'll get to real life. It's just that little portion. But it's like a 4 or 5 doctors sitting outside each room, and we go to each room and talk about the patient, what happened overnight, what are the abnormal labs they're imaging in our plan for the day. And then we go into the room and then we speak with the patient and the family members and give them updates. So that's what we do basically until we finish rounds. And then by that time, I'll either have a meeting or I don't have a meeting in the conference, I'll go eat. And then I will finish my notes and then wrap up and get ready to sign out to the 19th. So that's basically how you do it every basically inpatient. That's around what you do. Outpatient is you're doing like more preventative medicine and you're doing like chronic conditions. So you can have a patient that's here for a physical exam or is there for a sick visit, or like if they have a cold or they're having issues with their medications, or if they have diabetes and they need more, they need better control of their sugars, or if their blood pressure is high, you are able to titrate or put them on the correct medication. Or if you have a new patient and you notice that, hey, he or she labs are not looking right, this patient needs to be, medically managed. Let's try that. If that doesn't work, then we will get some other resources that the patient may need. And our clinic is very 360, meaning that we have a social worker, we have a pharmacist, we have a free clinic for patients that are not able to afford Medicare. So we help them get to see specialists. We help them pay for prescriptions. I mean, we really do a full 360 of the patient. And that's basically what you do from about 8 to 5. They hand you a clipboard, you go see the patient, then you talk about the patient with your attending, and then you tell them about your plans, and then you go to the next patient. So that's basically the difference, 8 to 5.
That's amazing. We do have a few questions on here. Would you like to answer those as well?
Okay, sure.
Okay. So the first question here is, can you talk about some interesting cases you may have encountered?
Some interesting cases. Let me think about that. So I would say, okay, so the most recent one was that the patient came in, they had shortness of breath, And we thought that so anytime patient has shortness of breath, we have to rule out the big red flags. So is it a pulmonary embolism? Do they have a heart attack? Is there something going on with their oxygenation and ventilation status? So usually we do like some, I don't want to get too technical, but we do some imaging, and that looks for to see if that patient has a clot. So this patient that we saw, they didn't have a clot, but they had basically a mass that looked like cancer, but it wasn't a cancer. It actually was an abscess. So luckily for us, we have the availability of specialists, and we were able to look at the imaging together, and we noted that, oh, it's not an actual cancerous mass. It's actually an abscess, which is a collection of pus, which is an infection. And you, of course, you treat that differently than cancer versus a infection. So I thought that was really interesting. So yeah, that was actually pretty recent.
Amazing. The second question we have here is, what were some challenges you faced in residency?
Oh my goodness, what challenges did I not face in residency? Oh, okay. So like, it's kind of like when you go from college to um when you go from college to medical school, they always say it's like drinking from a fire hose. And um it is exactly like that. And it's something you don't fully understand until you go through it, if that makes sense. So with medical school, it was like a lot of information, a lot of like just constant information, like volume overload. And then you're like, okay, you kind of get the hang of it. You starting to apply. And then from there, you start to apply it. And then you're like, okay, it's not that bad. But then you think you know something, and then you go in residency, and you realize there's so much more to medicine than you thought you know, or you thought you knew. So, I mean, because not all the patients present like a textbook. Like, they're not reading a textbook and saying, "Oh yeah, yeah, I have pneumonia." Like, no one's gonna just come out and tell you that they have pneumonia, and it's not a multiple choice exam where you're like, okay, it's not this because of this, it's not this because of this, or, oh, well, this patient did present like this, so the answer is C. There is no multiple choice. You have to put all the pieces together and an efficient and correct way in order to come up with the diagnosis and treat it. And I think sometimes that can be a little overwhelming because you're going from student to actual physician. And I think that can become very like difficult because you're changing a huge role. However, I don't think that it's not doable. I think anything that you set your mind to is doable, but at the beginning, it can feel very, very overwhelming. And then each year comes with their own responsibilities. Like, first year, it was like getting used to, somebody calling you a doctor, your new role of putting in orders and taking care of taking ownership of the patient. And now I'm in second year, and now I'm, covering the entire list versus me only having like 5 or 6 patients. Now I'm holding up to 18 patients. Then I am making sure that the new intern, which is the first year, is doing what they're supposed to do, making sure they put their orders in, making sure they know how to assess a patient. So each year has its own challenges. So, I mean, I still love what I do. I still love being inpatient. Like, even now, like, I'm exhausted. I've worked 6 out of 7 days, and I'm sitting here talking to y'all. And I literally just ran home from the hospital. So I think it goes without saying is, once you find what you really are into, like whether that's medicine or something else, but specifically in regards to like the specialty that you choose, you will know what is your specialty that you like, because I can sleep for like 2, 3 hours, 4 hours some days and get right back up and do it all over again. Yes, I am tired, but I'm happily tired because I'm doing what I love to do. And I think that's where people miss it, because residency and medicine in general can become very overwhelming. It can take over your life if you allow it to. And I think it's important to make sure your mental health, your emotional health, your physical health stays in the forefront. Like, even though I work 6 out of 7 days out of the week, yes, last night we went to go skating. I went to the gym. Like, I go to the gym like 3 or 4 times out of the week. I take care of myself so I can take care of others. So I think that a lot of people don't talk about that enough, but it should be in the forefront for sure.
And there is a follow-up question to the one that you just answered, and that is, what are some common challenges you experience in this role?
Common challenges. I probably would say, I think there's internal and external challenges. I think the internal challenges is more so getting used to the role, um, and feeling like you don't know anything when you do. Um, I think that's probably like the hardest challenge, of just believing that, hey, I know this, I went to school, I just need to apply it. I think that can be probably the biggest challenge, because it can become very overwhelming. I think that's like more of the internal portion that I was talking about previously. Externally, I think as not only a woman, but as a minority, in medicine, a lot of the times I'm not seen as a physician, which is fine. But I think that it's kind of interesting that, even though in some cases where you'll be speaking to someone and you say, "Hi, my name is Dr. Walls," and they say, "Oh, you're the nurse," or, "Oh, you're one of the techs," and you can have like a full conversation with someone and they will still think that you're not the physician that's treating them when you are. I think that that is some external things that can become a challenge, but I think that goes with anything. I think in a lot of spaces that women are not um that high in percentage. That's just something that I believe that we all, a good majority, experience that, just because they're like, oh, it's a woman, I expect her to be in a different role or something along those lines. But I would say that's probably an external challenge. I would say staying motivated to read and study and but what is it? Make your craft, because like today I worked 12 hours, and I still, even though you work 12 hours, you still have to come home and read. You still have to come home and study. You still have to come home and work on reports and cases that you want to get published. I mean, it's medicine is a evolving entity. It never stays the same. There's always something new and better, whether that's medicine, whether that's therapy, whether that's a new study that came out about an old drug or something along those lines. Medicine is changing every single day. So yes, you need to be able to balance that, like I said before, with like physical activity, hanging out with friends and family, or doing things that you love. But at the same time, medicine does come with a lot of requirements, and that requirement is to stay up to date with things that are required of you, whether that's the new medications for pneumonia, or the new medications for COVID, or what to look for, what to order. That is constantly changing. So it's something that you have to be privy to.
Perfect. There's another question, and that is, how did you choose your specialization? Any inspirations?
So I chose my specialty based off two things. I was introduced to my specialty went before I even went to medical school because a family member of mine had multiple sclerosis and was seen by internal medicine physician that basically was the glue to all of his management. People don't realize that internal medicine is basically the start of all of adult medicine because they're the ones that are able to recognize whether that's an outpatient or inpatient. That's when that preventative medicine comes in regards to, hey, this patient is not looking right. I may need to do a couple more tests and then send them to that specialist. Or let me send them, let me ask for an extra hand in this case. For example, um, what a family member of mine had multiple sclerosis. He required to be seen by hematology oncology. Who set that up? Internal medicine. He required to be seen multiple times in the ICU. Who set that up? Internal medicine. What is part of ICU? What is part of internal medicine is critical care, which is ICU. So I was introduced to how communicative and collaborative internal medicine was from a patient's perspective because it was a family member. And then I went into medical school and I went in and I did an elective and I did an elective in internal medicine. I'm trying to remember, I did 2 or 3. I think I did 3 electives. And I mean, the first elective I was sold. I loved the inpatient flow. I really loved being in the hospital. I loved the acuity of patients. I loved that I was able to not see the same thing over and over and over again. I was constantly seeing something different, whether that is pneumonia, heart failure, COPD exacerbation, or if a patient had a thymoma, or if they had myasthenia gravis crisis, or if they had acute kidney injury, or if they had a stroke, or if they had C. diff. I mean, it's just like the amount. I felt like internal medicine covers basically everything but pediatrics and OBGYN. And I didn't want to be stuck where I felt like that I was seeing the same thing over and over and over and over again because I would get bored. I mean, at least that's what I would think. I would get bored, and I couldn't necessarily pinpoint one system that I really, really, really loved because I really liked all the systems. So yeah, I'm still not 100% on my plans on what I want to do after I finish residency, but right now I really am looking into night medicine, which is basically internal medicine at night. So yeah.
And one last question we have here. How was your experience in med school?
Oh, med school's hard, just like any any other med school. Um, like I said before, like it is literally like drinking out of fire hose with the amount of information that is required of you to not only retain but able to apply it. At that time, at the beginning of the portion to questions, but then eventually, of course, to patients. So going like in college, you would like read a chapter like over 2 months. You could finish a chapter in lecture hall in an hour. So I mean, it was just volume overload, but you figured out what worked for you and how you studied. Did you like to go to class, or were you a person that liked to watch the videos? Or were you a person that went to some classes or some videos? Or were you a flashcard person? Or where did you have to write things out? And the way I studied in med school wasn't the same way I studied in college, and the way I studied in residency isn't the same way I studied in med school or college. So it's just knowing how you learn best. And once you're able to do that, the rest is history.
That is it for the questions. So thank you everyone for joining us, and thank you, doctor, for joining us despite your busy schedule. And there is a link in the chat box for the quiz, so please complete that for us to record your